The first group of muscles are the muscles for facial expression. So let's look at first at the diagram on the left-hand side of your slide. I want you to notice first the frontal belly is the same thing as the frontalis muscle. Also, the occipital belly is the same thing as the occipitalis muscle. We also have the temporalis muscle, the orbicularis oculi muscle, the zygomaticus minor, zygomaticus major, orbicularis oris, mentalis, masseter, and buccinator muscle. And the image on the right-hand side of your slide has a purple mark on the buccinator muscle. So it's an important muscle that you should be able to identify. So in any of these diagrams, especially the ones of the cadaver, which you see on the slides. So let's look at some of the functions of these muscles. The epicranius is the over the scalp area. And as I mentioned, the frontal belly is the same thing as the frontalis muscle, and it's responsible for wrinkling the brow of the forehead. So the attachment sites are not important unless I specifically mention them. For the occipital belly, that's the same thing as the occipitalis. And when you contract it, it's responsible for retracting or pulling in a posterior direction the scalp. In the mouth region, we have the buccinator muscle, the muscle that was highlighted on the previous slide. And it's responsible for compressing the cheek, also holding food between the teeth during chewing. Another muscle in that group is the mentalis muscle, responsible for pouting or protruding the lower limb or wrinkling the chin. So it may be a good idea to make note cards for some of these important muscles, again, with the name of the muscle and the action. Continuing with this group of muscles for facial expression, we have the orbicularis oris, which is sometimes referred to as the kissing muscle. So if you're leaning over to maybe kiss your niece and nephew, you would be using your orbicularis oris muscle. The orbicularis oculi muscle is responsible for closing the eye, so it's used in winking, blinking, or squinting. We then have the zygomaticus major and the zygomaticus minor, both of which have the same exact action. So they're thought of as the smile muscle, and in particular, they elevate the corner of the mouth. The next group of muscle in the skull region is the muscles of mastication, which is the process of chewing. Most of these muscles are going to move the mandible at the TMJ joint, which stands for temporal mandibular joint. It's not important that you know which cranial nerve innervates them. You'll be learning about some of the cranial nerves later on in the semester. But the temporalis muscle, which is on the temporalis bone, elevates and retracts the mandible. The masseter also elevates the mandible, but it protracts the mandible instead. So the temporalis would pull it backwards, retraction, and the masseter would protract the mandible. This is showing a deep lateral view of some of these muscles, again with the view of the buccinator on the right-hand side of the slide. We also see the temporalis view, the orbicularis oris, and the masseter. The muscles that I'm purposely not highlighting are the ones that you're not responsible for. For the temporalis muscle, it elevates and retracts the mandible. The masseter is going to elevate as well, but it protracts the mandible. So it would be the prime mover of jaw closure. And remember, the other term for prime mover is agonist. The next muscle is the sternocleidomastoid muscle, and it's one muscle in particular that's named for its origins. For example, it attaches to the mastoid process, as well as the clavicle and the sternum. So one of its functions is rotation of the head to the opposite side and also flexion of the neck. So as you can see, attachment sternum, clavicle, and mastoid process. Muscles that move the head would in fact include the sternocleidomastoid muscle. And we can see that highlighted on this cadaver image on the right-hand side of your slide. So shown on this diagram would be the sternocleidomastoid muscle, the trapezius muscle, and I'm not highlighting any of the other muscles because you're not going to be responsible for them. The next group of muscles is for the muscles of breathing or respiration. These would be muscles involved with inhalation and exhalation. During inhalation, the muscles contract to increase the volume of the thoracic cavity, allowing air to flow into the lungs. During exhalation, muscles are going to contract and others relax, so the thoracic cavity decreases in size. So the most important respiratory muscle is the diaphragm muscle, and it's dome-shaped. When it contracts, it actually increases the intra-abdominal pressure. So this muscle in particular could be used for other things like urination, defecation, childbirth, or the movement of venous blood. So this diagram is showing us the muscles of respiration. We're looking at a view looking at the diaphragm. It's an inferior view here, and this is the central tendon of the diaphragm, but the entire diaphragm spans this entire region. And remember that it's a separation between the thoracic cavity and the abdominal pelvic cavity. For the external intercostal muscles, these muscles are responsible for breathing in, which is inspiration, so they increase the volume of the thoracic cage, whereas the internal intercostal muscles would be for forced expiration. So the muscles of respiration are in this chart. The diaphragm, it forms the partition between the thoracic and abdominal pelvic cavity, causes flattening. Contraction causes flattening of the diaphragm and expands the thoracic cavity. External intercostals are for inhalation, and they extend from the superior rib to the adjacent ribs, whereas the intercostal muscles depress the ribs during forced exhalation. Therefore, they would be the antagonist to the external intercostal muscles.